Hey guys, thank you so much for joining me. It's Brandy here. I wanted to go into some more on the coronavirus. So, this is a virus that, of course, everyone is talking about right now. There has been debates on some people are like, stay in the house, stop making everyone sick. Other people are like, oh, this is a hoax, it's completely fake. There is no coronavirus. So what do I feel? I personally feel I think the virus is real. Um, so I do feel that way. I do feel the virus is real. But I do also think that people are panicking over this virus. Why? Because you think about the flu and how widespread it was and how many people caught the flu. And I still work part time in healthcare, and people still have the flu, like this month, which is March. People still have the flu. Of course, it's more common. Michael? My son. So it's still more common in December and January, and you see it some in February. You see a little bit in March as well. You don't see it much at all in April. Okay, so like by April, some people, there's very, very few. It's sort of like when it gets to April, it's sort of how like the coronavirus is now. Very few people have it. And I know people have said, oh, well, a lot of people have been diagnosed with the coronavirus. But it's actually not that much, not that many people if you compare to the world. There's a lot of people in China. China's the biggest country. So, of course, it seems like it's this big thing, but in the U.S., for the diagnoses that we've had in each state that has had it, it hasn't been like this very common thing. It's not super common. Like, the chance of any of us getting it is probably less than 1%. So, we'll see how it spreads over the next few weeks because they put everybody in a quarantine. And you realize most people are recovering from this virus. Those with weakened immune systems are the ones that are more at risk. But they have actually tried like Planaquil, and they said that it's an effective, it's an anti-malarial, and it's also a medication that it helps inflammation, like in the lungs and throughout the body. It is also used for lupus patients, people with autoimmune diseases. They have checked this medication out and has shown promising effects for the coronavirus. So that is something to look into. If like somehow you're diagnosed with it, ask for this medication because that's something that you might really benefit from. Now, I really do think children and the elderly, especially the elderly, are at risk, or those with weakened immune systems. I know I have a weakened immune system, and I do worry some, but I'm not freaking out or panicking. I'm not going to like literally quarantine myself. I can still go to the store. I will still sometimes take my son to the park. I'm not like, I wash my hands. I keep my son's hands washed. I bring sanitizer with me. I don't want to get sick. I think no one wants to get sick. There has been one diagnosis in our county, one single diagnosis. That diagnosis was a few weeks ago, and it's still at number one. That person has probably, this was like 2 or 3 weeks ago, I believe, and that person has healed, and no one else has contracted this virus in this county. So no, I don't think it's a hoax, but I don't really think that that you have to worry about it. Like, people are literally scared, and the media has portrayed it as this horrible thing. And I read up on the CDC. I read up everything I could, not everything, but I read up on a lot. Symptoms are it's risky as the flu is. Symptoms are kind of similar to the flu with less body aches, but there have been some people that have reported body aches having this. But, fever, shortness of breath, things like that, very similar to the flu. The good thing with the flu is there's antivirals that you can take within 48 hours that help. And we haven't found anything to really drastically help besides Planaquil has actually shown to improve these symptoms and just work. They have shown it to work. That is a good thing. That's a good thing that they have kind of found to be effective in helping to fight this, which is an antiviral and a malaria drug, and it also helps people that have lupus to get their body kind of in remission from the disease, which lupus is. And there's others. I think some people take it for, just different autoimmune diseases and things like that. This is promising. But I think the probability, and whoever's watching this, whether you're in the UK and wherever you're at, I think the probability, unless you're in China, and even then, I think the probability of you actually contracting it is slim to none. So if you think about it, and I know I had one of my friends, it was funny, I run across on Facebook. She was asking, she posted, does anyone know anyone that has coronavirus? I said, I have thousands of friends on Facebook. She said, so I'm curious. And I was curious, I read through the comments. No one even knew anyone that had it. It's easy to kind of think that, this is a scam virus when you're thinking, hey, very few people has had it, but there has been diagnoses. The CDC has confirmed this, not saying that they're lying, that they're not lying, or they're lying or anything, but I believe that it's a legitimate virus. I believe that that's kind of been proven, but I don't necessarily also believe everything I read either, but I do think that people are way, way over exaggerating it. As far as the quarantine, it might be a good idea to kind of settle this virus down, so that will help prevent more deaths. And if people can be quarantined for 2 weeks and it can prevent one death, I know that people's out of work and people are losing money from this. I know that people, it's a few weeks. I know that, but if it can save one life, because somebody in one city, this is going to actually possibly, very likely, prevent many people from spreading to many people, which is a good thing, which they should probably do that more with the flu too, I guess. So why not do that with the flu? It can save more lives as well, if they don't do it. But, I do think that, so I'm not judging with the quarantine. I'm just saying that more people need to be washing their hands, which can prevent you from catching it and prevent from the spread of others. If everyone followed the simple 20 to 30 second hand washing, 20 to 30 seconds. I've been out in public and, I've used the restroom in public when I really have to. So I have a weak bladder in general, but I'll use the restroom in public and I'll come out and I'll wash my hands. I've noticed other people, they literally go in, squirt some soap, wash their hands 5 seconds, and they're done. The standard that you can look up the chart is 20-second hand washing, at least 20 to 30 seconds. So I'll follow a 30-second hand washing with enough to foam up and just kind of wash thoroughly my hands, okay? It's very important. And do that several times a day. Now, if everyone would do this, it would really help. But not everyone is going to do this. And I know people that complain so much about catching the flu and that catching even colds, and complain so much about it, and they're not doing anything to kind of protect themselves. These are people that just don't really, I'm not judging, because I have a weak immune system. I take probiotics, immune boost, vitamins. I used to get sick Washing my hands a lot. I still used to get sick 3 or more times in a year because I have a weakened immune system, a compromised immune system. But since I've started my immune boost vitamins and probiotics and trying to, also put healthy foods into my body, I don't get sick. I might get 1 cold a season. I might go 3 seasons without getting, I might go a few seasons without getting sick. And then when I do get sick, I'll have like 1 small cold that goes away in a few days. Where used to, I've had some that turn into something like pneumonia. I really have. I swear I have. And so I've had to kind of do this for myself to boost my own immune system, because I don't like getting sick. And there are people that complain and they don't do anything to kind of help. You go into Facebook and people will complain like, all I do is get sick. All I do is get sick. I hate getting sick. Or they're the ones that just complain. You notice some people that will complain every single day about something. Instead of enjoying their life, they always have something to complain about. So, of course, they're going to be the first to complain when they get sick. And they're going to be the first to kind of freak out with an epidemic like this. There are going to be people like that. I'm sorry, I can't really stand it. I mean, I try, and I'm not one to judge people. And I try not to, and I don't comment, or I'll usually say, I'm praying for you, or I'm sending you good vibes, or something like that. But eventually, if I see that from that person like so much, it just kind of annoys me. Because, because I've like made suggestions to help them. That's helped me, and that's helped others. And they're like, they don't care. They just want something to complain about because they don't, so you can't help everybody. You can't make people listen. And that's just an unfortunate thing. So I don't even go on into social media and post much about this because no one's going to really listen to me. Some will agree with me. And then others probably won't agree with me, but I posted something about, my fiance is, really the type that always worries with a new virus, and he always worries with the flu in general, like overly paranoid with it. He has not had as much as a cold in 7 years. Not even joking. Not as much as a cold. I have a weaker immune system, naturally weaker immune system. He does not. He has a very strong immune system. He doesn't necessarily even have to eat healthy. He has a naturally high immune system. So, he doesn't get sick. And I don't know why he's so worried. So, he doesn't like getting sick. He's not able to handle it too well. He's told me that, he got sick. He got the flu, I don't know, it was 10 or 12 years ago. And he says it was a flu. His dad said he thought it was a cold. He was never tested. I think it was a cold. He just puts it off as a flu. You know how man cold, man flu, because men can't tolerate certain things. It'll lay them up in bed where it might not be as, we can still clean with a cold and do things like that. And a man will lay in bed for a week sometimes if it's a bad cold. So, not judging, because not saying all men are that way. Some men are very strong. Just saying some can be that way. Just like some women can also be that way too. But I'm not taking too much into this virus because, there are people that are just, I know I've seen something on this one lady post on Facebook. You people annoy me, so y'all need to stay at home. And I don't know who she's talking about. She's just ranting out loud. You people need to stay at home. You're causing the issues and this and that. And I just get so annoyed because I'm not out here going out in public. I had to go grocery shopping, so that's something I did. We have this small little park, and I've taken my son there a couple times already. Since this has been going on, I've taken him to this small park. I carry hand sanitizer, and I carry the sanitizer, and then when we leave, before we even get into the vehicle to come back home, I sanitize our hands as well. Um, but we're not going out to a whole bunch of public places or amusement places or anything. This is a small park. It's um, not like a lot of the bigger parks. It's just very small. I think there might have been a couple kids there this whole week. So it's not real publicly like, however you want to say it. It's not a lot of people that goes there. So, yeah. So, I mean, a lot of people are, especially with the quarantine, the likelihood of it spreading a lot is going to be very low because of how the quarantine is. I really do think that this is going to die down. Within the next month, this is probably going to be gone, completely gone by Easter, by April something. And, maybe even before then, there might be a couple cases this month. There might be some more cases this month. The cases will go up, obviously, but I think this will die down quickly. I really do. There's not really a doubt in my mind about that, but that's my intuition kicking in and telling me so. And I have a very, very, very good intuition. I've not been wrong about a lot of things and my feelings. I really, truly think. And I've also read on it, and I haven't really asked specific questions on it, but I really do. Like, I can use my Sacred Destiny to do a quick reading if you would like me to do one, to ask if this virus will go away quickly. I actually did a tarot reading up on this virus, and I didn't really look into when it would be calming down. So I'm going to ask if this virus will be going away soon. So let me concentrate on trying to get out of the light here. Truth into the reading. Truth into the reading. Truth into the reading. Okay. So I'm going to pull some cards on this. Embracing. Stillness. Pull another card. Simplicity. Sort of like just embracing this time, this alone time that we have. Potential. And voyage. It's like traveling. And this virus has been traveling. Leadership and delight. So I'm going to go into these cards right quick. I'm going to draw one more. And I drew abundance. We have a lot to be thankful for. 1 week. That would be the first one. This will be this week. This will be next week. 1, 2, 3, 4. By 5 more weeks, I feel this will be gone. By 5 more weeks. See the Delight card. It's very pretty. I just love the Sacred Destiny Oracle deck. So I didn't draw into any deep readings with tarot. I drew into the simple Oracle. So we're embracing this time. We're embracing this alone time. We're just taking this time to spend with our family. Okay, so we're taking this time to embrace our family and to come together as a nation. I mean, this is actually helping us to grow stronger. This virus is helping us to grow stronger. I mean, honestly, as a nation. And so we should just embrace this time. We should just embrace this time. It gives us a lot to think about, and a lot of, to spend and enjoy with our family, which a lot of people, just to live a simple life, just simplicity, just to live this simple life, just to, but yeah, the virus is traveling, leadership is coming through. In the meantime, we just deal with this, but just give it 5 and 6 more weeks. It's like my 5th week card, 6th week card, 5th and 6th week card. So I really do feel that this virus is not going to be around much longer. And I just think that this is just the time to just kind of spend time with your family. And I mean, for those that have to work in medical and truck drivers and those that have to work that are out here doing good, and all to not worry too much about your family, and to pray for them, and just go, this is helping us all come together. And but anyway, I want to thank you guys for watching. If you have any questions, comments, leave them below, messages, anything else. Thank you for joining me. Be sure to like and subscribe, and I really appreciate you watching.